Good morning, everybody. The topic that we are addressing today is of extreme importance. Non-communicable diseases such as the well-known cancer, heart diseases, respiratory diseases, diabetes, and the reason that we are here today, stroke, are the leading causes of mortality in the world. This day is a momentous day in the sense that we have been working collectively to produce a stroke action plan for Europe. And today we get the opportunity to present this to the European Union and to all the critical decision makers who can help to conquer the scourge of stroke. I wish to express my gratitude to the Romanian Presidency of the Council of the European Union for supporting this event, which is organised under its official patronage. And I would like to thank in particular the Romanian Minister of Health, Serina Pintea, who unfortunately could not join us today, but she made sure that this topic is not overlooked and asked Secretary of State Tiberius Marius Bradatan to represent her at this important event. I would also like to take this opportunity to welcome all of the European and national actors, influencers, and interested parties who are here today to share their experiences and ideas on the role that policy can play in tackling stroke. Stroke is the second most common cause of death in Europe, with nearly 100,000 deaths each year. In Europe, over 13% of women and nearly 10% of men die from this disease each year. And as we've heard from Kathy, given current demographic trends, the number of people suffering a stroke and the number of people living with the long-term effects of stroke is expected to rise significantly in the coming decades. Consequently, effective healthcare planning and adequate resource allocation across Europe is needed to deal with this public health challenge, taking into account that the emotional and financial burden of stroke is largely borne by stroke survivors and their families at the moment. In 2017, SAFE presented the report Burden of Stroke in Europe, which revealed that significant disparities exist in stroke prevention and care, not only between European countries, but also within the same country, region to region. Based on these findings, last year, SAFE and ESO released the 2030 Stroke Action Plan for Europe, which proposes a holistic approach to stroke management, from prevention to acute care, through rehabilitation to life after stroke. The report sets out minimum targets to be reached by every European country to equalise the quality of care across Europe. And so today, we have a great opportunity to share best practices and identify how individual countries can improve their stroke management plans and how European policymakers can support these efforts in tackling the scourge of stroke. I am delighted to officially open our discussions and give the floor to the Romanian Secretary of State, Tiberius Marius Bradatan, for his keynote speech. Thank you very much.